Dr. Fadi Bakal, thank you for being our first guest on this show, Sarah Straight Up. I'd like you to introduce yourself in your own words to everybody. Tell us a bit about yourself.
Sure. Thank you, first of all, to being the first guest on your new podcast show, which is a very great achievement. I'm Dr. Fadi Bakal, triple board certified, Western trained in several countries, actually, Belgium, Holland, and Austria. And I did my training as a plastic surgeon for a couple of years, let's say, to shortenize everything. And after that, I did more to become more skilled and experienced. I went to another country to actually, to have more knowledge, more experience, and also to acknowledge also more the plastic surgery field, which is a very fast field, actually.
What got you into plastic surgery? Why plastic surgery? I mean, there's a million other things you could have done in medicine.
That's true.
Why plastic surgery?
I was waiting actually for that question.
You knew I was going to ask it, did you?
So why plastic surgery? Plastic surgery, actually, it kept me on going through only one sentence throughout the whole education and training. It was the game between the inner and the outer. And every person of us, including you, me, we have some certain aspects, certain thoughts, certain experiences about our inner self, but also about the outer self, So, and the combination of those two, you see a lot within plastic surgery. It's a specialty where this is a dynamic process. And when someone chooses for a certain treatment or a surgical procedure, he or she already done this process within themselves.
Okay. Yeah. So they've already thought about what they're doing, and you want to put that into reality.
They did already their homework
before
coming.
Homework. They know what they want, and you need to deliver and execute that.
Yeah.
So you've had a career that's taken you from Vienna to Brussels and now in Dubai. Why Dubai? What brought you to Dubai?
Why not Dubai?
Good. I'm here to ask you the question, so you can answer mine. Why Dubai?
No, Dubai is actually becoming, for the last several years, and you know that as well as I do, is becoming an international medical hub for actually all the medical specialties, but especially also plastic surgery, because it's all about aesthetics, it's all about being a high performance, looking great, the appearance. So Dubai actually is very dynamic, so as plastic surgery, and it provides actually the full opportunities to thrive and to grow as a consultant plastic surgeon.
You make a good point about Dubai and how it positions itself, and everybody's attaining this kind of perfection, if you like. When is it too much? Do you think sometimes people are harking after or going after something that's unattainable, even as a plastic surgeon? Or can you do everything and anything to change a person's look?
That's a bit too short to say, or too sharp, rather. You cannot do anything or everything, but still there are limitations. You can improve a lot, you can correct a lot, you can still change a lot, but within the certain identity of that person.
Okay.
Yeah.
And how do you navigate that fine line between I come to you and I want you to enhance how I look, my features, rather than making me, I don't know, we see these movies where somebody has another identity and you've had all the surgery done and you can't identify them anymore.
It's actually very
What's
easy.
The fine line?
Yeah, it's very easy. How I approach it during my consultation, or the first consultation even, and really all my clients and patients appreciate that, is we look together in the mirror. Okay, what are the desires? What are the needed or necessary corrections? Or what is the possible corrections that can be performed?
Mm-hmm.
And in that approach, we can give an realistic expectation about the result and the outcome in the near future, after the procedure or after the treatment.
So if I come to you and I give you a magazine and say, I want to look like J-Lo, make it happen,
Sure.
what are you going to say to me?
No, what I'm going to do, not say, is I'm gonna close it and throw it away.
Okay.
Why? Because every person
Are you
is
saying
different.
I can't look like J-Lo? No, I'm joking.
Yeah, you can look even better.
No, I'm joking. Carry
No,
on.
but actually every person is different. On picture is even much more different from the same person than it also in reality when you see that same person. So what I'm trying to say is everyone is unique, everyone is different, so it needs an individualized approach during the process of, okay, what needs to be done, what are the needed or desired corrections to achieve the results.
Dubai is a place where it's full of luxury, full of influencers. You know, everybody thinks we live in utopia. It's bling bling. I know certainly when I've traveled and I get asked about Dubai and people have a view and a vision of it. Do you think living in this jurisdiction, there's more pressure on women and men to look a certain way or to attain a certain ideal?
I think there's a high pressure in currently, nowadays, the time that we are living in. Globally, there is a high pressure, yes. But especially in Dubai, why? Because in every category, in every sector of the market, not only plastic surgery, but also in your sector, also in other sectors of the market, it's very high dynamic. So there are a lot of changes, a lot of opportunities, a lot of growth, which sometimes you cannot keep up with, you know, and that gives a high social pressure. Yeah.
And how do you think social media has contributed to that? Now, I look at different generations and their views of social media and how they use it or who their role models are.
Yeah.
And nowadays, and you can correct me if I'm wrong, but a lot of people want to look the same. I see a lot of people, if I'm out, looking the same.
Yeah.
And either they're all having the same procedures or they have the same idol. So how do you think social media plays into this, and what's your view
It plays
about it?
a huge role, actually, unconsciously, but also very consciously. So we live in an era of internet, and now AI is coming up. Social media has had a boost, actually, the last years. And that's why influencers called influencers. They influence actually what they do, how they behave, how they dress, how they look like, you know. Also in makeup and cosmetics, it's all been influenced. Is this bad? Well, it will give some ideals or an image. And in my work, I don't see that it's a negative influence, but people get more aware of themselves, how they look. And especially, actually, if you give me 1 minute to explain that, going back to the era of COVID, everyone is changed from personal meetings in person to Zoom meetings or online meetings.
Yep.
And I had a lot of patients coming after the meetings. Actually, I wasn't paying attention to the meeting. I was paying attention to how I look in the camera.
Yeah.
So that changed a lot, actually, globally.
I think that's correct. I think I can resonate with that because we were always seeing ourselves on camera and
exactly
whatever we might be wearing, because everybody, let's face it, wore like a nice blazer with maybe shorts underneath or, you know, pajamas.
Exactly.
But the face was always present when you had to put the camera on. So I see what you're saying there. What procedures are now trending, if you like? And are there any that you don't agree with that if I came to you, you'd be like, I don't think you should try that? And if so, why?
There are a lot of trendy procedures actually within plastic surgery. For instance, liposuction, injectables, going from non-invasive to actually invasive treatments, which means surgeries, or non-surgical like fillers, injections, Botox and fillers. But also in aesthetic, breast augmentation, liposuction, abdominoplasty, mommy makeover, tummy tuck, you know, those are still very increasing in numbers every year. And sorry.
No, anything you personally don't agree with that you think shouldn't be done or that you wouldn't carry out or you'd advise strongly against?
Yeah, well, nowadays the world is a village, which means a lot of traveling, which means actually medical tourism. Now, For sure, you can agree with medical tourism if you are going to a certain certified plastic surgeon who has the skills of this procedure that you desired, but do it in a safe and a high quality way, so that if there are problems, then you can be expected. It's a realistic result.
I think that's a good point, because we hear about these horror stories about
Yeah.
people who've gone abroad, died, had
Yeah.
injections done. Maybe they've tried to do it on the cheap. Maybe they've heard from someone else.
Yeah.
And it's quite sad as well.
Yeah.
These are real people. It kind of leads me to my next question of, and I'm playing devil's advocate, I'm not having a go at the plastic surgeons worldwide, but are you just adding to a fake world? Everything is becoming so tech, so AI, so fake. Is there something to be said about people doing plastic surgery and becoming a fake version of themselves? You might say it's a better version of themselves, or they keep having procedures. Where does it end?
Where does it end is actually very difficult to say, because that's very subjective to that particular person.
But as a doctor, do you ever step in or say, enough's enough, you've had 15 lip jobs now?
No, for sure, for
6
sure.
nose jobs.
Yeah, for sure. No, for sure. Because every surgery that you repeat on the same location, you will have a much higher risk, actually exponentially. And that gets your life in jeopardy as well. So yes, I do step in, but after explaining thoroughly in the mirror, okay, what are the limitations, what are the risks, and so on. Is it very fake? I don't think so. If you approach it like what I just explained, you approach it with the realistic expectations, most of the patients and clients will be very happy with the result, because it's still natural result. It's like I always tell my patients, okay, Sarah, some friends of you...
I'm not your patient, just in case anyone
No,
thinks.
I know. It's like I'm giving you an example.
Yeah, I know, I'm just joking.
So they see you after 2 or 3 weeks, and you did something, but they don't know what it is.
Yeah.
And that's what I try to achieve in my work.
So it's a kind of natural look.
Yeah, but they
through
see
the surgery.
you
they
are
see a difference.
Flourishing. You're more glowing. You are more alive. But they don't know what it is until you say, and they say, okay.
But I like that. I like the fact that you're not trying to or you'll advise people from trying to change them wholesale.
Yeah.
What about the young girl who comes to you, let's say, in her 20s and wants a certain look or wants certain aspects of her body augmented? Do you ever advise or look into, or does she, if as far as you know, look into, well, do I still want to look like this in 15 years or in 10 years? And what I'm doing now, it may well be reversible, it may not. But how do you navigate that? Like someone wanting to look a certain way, they may not want to look like that in the future when they're older, more established, perhaps when they're a mother. It might not be the look for them that they want when they're 21 or 22.
Before I answer that question, I can refer to or compare it actually to the example of having a tattoo on a young age, which will stay forever. And maybe you will regret it in 15 years or 20 years or even 30 years.
And so you have it removed.
Yeah. Now, for surgeries or for plastic surgery on a young age, it doesn't have to be a bad one or a less desirable choice to do. Why? Because it will give a boost to your self-image, your self-confidence, and your quality of life. And when you can maintain or improve these 3 factors with plastic surgery, it can be very rewarding for a pretty long time actually in life. Now, I do give near future and future realistic expectations. For instance, if I would perform breast augmentation with silicone implants, yeah, for sure, because it's a foreign body. So I need to give that information, and most of them are very understandable in the limitation of the technique of the material, and still they choose actually to do it.
And how far is it the responsibility of the person who comes through your door I say that because I think sometimes people may have unrealistic expectations. I'm a mentor, I run a lifestyle, I'm also a lawyer, I run fashion. But I can do so much and I can help you to a certain degree. I need you and I need your buy-in. So how far does you putting them under the knife, doing the plastic surgery, assist what they want? What do they have to do going home? And is there a lot to do? People may well have unrealistic expectations. I'll go and see Dr. Fadi and I'll come out a brand new person and lots and lots of different, more confidence, and my life will change.
Yeah.
What does the patient have to do?
Well, if you're referring to the aftercare, because that's actually much more important, or even the same importance as the surgery itself. Because plastic surgery, I always compare it with, if you plant a seed in earth, next day is not going to be a palm tree. So you need to have patience, and patients need patience.
Yeah, true.
So what I mean by that is the aftercare is even more important. Their homework is longer than my homework, which means they have to treat the scars. They have to manage physical activities. It's also sometimes a change or give a different direction in their lifestyle prior to surgery. So it's not only the surgery itself, but it's also the change in lifestyle after.
And you educate them about that?
Yes.
Do you have cases where people don't listen or they regret having things done?
Sure.
And how do you deal with that?
That's why we're human beings.
But how do you? I've come to you, not just for the record. I don't, and I won't have plastic surgery yet. I've not.
Yes,
not
that's for
quite
sure.
got
You
there.
before beginning of the podcast, you already told me I'm not going to do that.
Dr. Fadi thinks that I'll convert. Well, we're yet to see. I'm all about non-invasive at the moment. I'm not at all saying people shouldn't, but this is the purpose of this conversation. But what I'm asking is, in terms of what people shouldn't be doing, what do you say?
There are a lot of people, they do listen, but of course it's their own responsibility at home. I cannot be with every patient at their home to tell them what to do and what not to do. But a lot of things they still can do, actually, because the downtime of, let's say, 20 years ago of all the surgeries that we're doing now is totally different from the downtime nowadays. Not only the techniques are improved, but also the faster you're mobilized, or the faster you move, or the faster you do things. You get your daily life actually pretty fast, So, for instance, after breast augmentation or eyelid surgery, after 1 week or 2 weeks, you already can actually progressively retake your daily life. Even physical activities, you can start doing them from week 2 or 3, And before the time we are in Dubai, so it's a fast pace. 2 or 3 weeks is actually nothing for the result that you want to achieve.
What do you do? And have you had the situation someone comes back and says, I don't like how I look, or I regret doing it and you shouldn't have let me do it and I'm not happy? They have a, kind of difference of opinion.
Yeah.
They've changed their mind or they've regretted it, not because you've done a bad job, but because sometimes psychologically. What do you do in those circumstances?
That's a good question, and it's a very difficult situation to deal with. But for the most time, actually, people search for explanation. People search for, okay, how is this done? And how come this has been achieved as a result? That's why the first consultation is a very thorough consultation from A to Z, including the aftercare, including the potential complications, what may happen, and so on. So actually, every patient of mine is very well prepared, and preparation is already 50% of the result.
And do you, as part of that preparation, do you ask, why do you want to do this? What do you want to achieve?
Yeah.
How do you think it's going to help? Do you go through that questionnaire with people?
Yes, for sure. Because when I ask that question and I get an answer, I do it because my partner wants me to do it, or my husband, or my mother, or whatsoever, then I stop. Then I say, no, then I'm not your plastic surgeon in
But
this.
do you refuse people?
I will explain to them that I won't be the appropriate plastic surgeon to
Okay.
you. So to give them a realistic expectation, actually. Yeah.
It's interesting, and it's
Yeah.
good to know that that does
Yeah.
happen, because I think sometimes people have a view that, you know, whether it's plastic surgeons, whether it's lawyers or anyone, we just take your money and we'll just do as you say because we're getting paid. But it's
Exactly.
not like that.
No.
There are ethics involved,
Yes.
and you
Yes.
will not
Yeah.
kind of go forward with something that you're uncomfortable
Yeah.
with because you're not sure that
Yeah.
they actually want that for themselves.
Exactly.
In a world where things are fake, I'm not saying plastic surgery, how do you as an individual keep it real? What do you think you do?
Yeah. I do think my motto also on my website is be first for yourself. Why I chose that, not only because my initials are look-alike for the be first, but if you are treating yourself very well and you can also achieve your goals, you will be also realistic in your expectations. And when you get that information from someone who is certified in that information or in the goal to help you and to assist you and to guide you, I think that will achieve a lot for yourself.
Dr. Fadi, would you have plastic surgery?
That's a good question, but I'm too young for that.
When you're older, in years to come, would you have plastic surgery?
That's about 20, 30, 40
Let's
years.
say it's 40 years down the line. The question remains, would you have plastic surgery?
Maybe.
Maybe. So it's not a no.
No, it's
And it's not a
no.
definite yes.
No.
It'd be interesting if you'd said no, because I would have probed you saying, well, why
Yeah.
why would you perform on others?
But then,
say
who can
no
I
to
trust?
yourself.
That's the thing.
And you can't do your own surgery.
No.
Dr. Fadi, it was an absolute delight to have you here today. Thank you very much for your time. We hope you enjoyed that with Dr. Fadi. So if you're interested in plastic surgery, if you want to enhance the way you look, not change your identity, and if you want some real advice, and if you want somebody who cares about you and the reason you're doing what you're doing, then please reach out to Dr. Fadi. Thank you very much.